Good afternoon. It is Saturday afternoon at 4 o'clock. It must be time for the senior moment. Hi there. This is Connie Clark with Home Helpers. And this afternoon, I have Dr. Alexis LaRose here with me, and she's a dentist here in the Coeur d'Alene area. And I thought it would be kind of nice to bring her in and talk about some of the issues that seniors might have as they get older pertaining to oral care. So welcome.
Thank you very much. I'm happy to be here.
And you're new to the area. You haven't been here too awfully long.
That's correct. I've been here now 4 weeks.
And where did you move up here from?
We came from Billings, Montana. It's a lot nicer here in Coeur d'Alene than it was there.
I think it might get a little warmer here.
Yes, it doesn't get quite as frigid.
Well, welcome to the area. We are very happy to have you over here with us.
Thank you very much.
And I am one of your patients, so I took advantage of seeing you this past week to ask you to come in and talk about this because my parents had dental issues, and I remember them dealing with those in their later years. And so I kind of knew from watching that seniors had some special things going on pertaining to their dental care. But now that I'm approaching senior age, I'm kind of concerned about me having those issues. So I went on the internet before we talked to pull up some information so that I could kind of know what was happening pertaining to this issue. And I'll just go down some of these things and maybe you can comment on them and we can talk about what causes them and what maybe you can do about it and that sort of thing. And the first one that kind of jumps out at me is dry mouth. What causes that?
Well, there's many things that can cause dry mouth. One thing especially that would happen is medications. So as people age, they're often put on more medications, and the side effects of most of these medications are dry mouth. So you add multiple medications that all have this symptom of dry mouth, and you can end up with a very dry feeling mouth. That can lead to a lot of things. Well, discomfort, obviously. Dentures and prostheses might not feel as comfortable. They might not stay in as well. Also, it can lead to a lot of cavities. So our saliva is a huge protector in our mouth. It helps prevent cavities and helps remineralize the teeth and helps keep them nice and healthy. When you don't have that saliva helping, you can end up with a lot of problems.
And the saliva, in reading this material, it helps get the food particles away from your teeth.
It does. It does that, and it actually helps remineralize the teeth. So
what do you mean by remineralize?
Well, every time you eat, and your saliva becomes more acidic every time you put anything in your mouth other than water. So as that acidity goes throughout your mouth, it takes about an hour for your acidity to reach a normal pH, to go back to normal.
Go back to where it was before you ate.
Now, during this time when your saliva is acidic, your teeth are constantly being demineralized, which can cause cavities.
So that's like taking the surface off?
It is, and that's kind of how it just kind of starts to eat away a little bit at the teeth, and it happens to everybody. I mean, this is just
not just seniors, but anybody.
No, it's just a constant way of life. You eat, your mouth becomes acidic, and your teeth demineralize. Now, an hour after you eat, your saliva works hard to bring your pH back to normal. So once your pH becomes normal, your saliva can remineralize the teeth. So it brings them right back to normal, so you don't actually develop these cavities. Now, if you don't have saliva in your mouth, you don't have that protective factor that can get your pH back to normal, which means you're not being able to get to that stage of remineralization.
And you said from eating other than water. So if you're drinking soda or
anything
coffee
with
or
sugars, anything pretty much will bring your pH down.
So if you're doing those things constantly all day, your saliva doesn't have a chance to go back to where it's supposed to be.
Yes. So if you're constantly putting something in your mouth, such as when you have a dry mouth and you're constantly sipping on, say, iced tea with sugar, or a soda or juice or anything like that, you're constantly keeping your pH
And you think
acidic.
you're giving more moisture in your mouth, but it's actually
Correct.
doing more harm than good.
Correct. So if you do want to have something, water is the best thing you can do. However, even that will rinse away the little saliva that you do have, which is the protectant factor. Although, obviously, you want your mouth to feel comfortable, so water's the best thing you can do in that case.
And do seniors, as you get older, is it a natural thing to have a little bit less saliva in your mouth, or is it medications normally that cause that to happen?
Usually it's medications. I mean, some people just have a dry mouth, but most of the time we're seeing it's related to something, whether it's medications or some sort of illness, because we see a lot of older people that have plenty of saliva. It just kind of depends.
And that can keep you from being able to eat and digest food, because your saliva is part of the chewing process to get the food. And so if you don't have enough saliva in your mouth, that may prevent you from eating because it's discomfort or something like that.
And there's actually a lot of products that we have as far as comfort goes and to help all of this process. Do you want me to go into those?
Go ahead.
Well, there's lots of different things. One thing is a biotin mouthwash. Biotin actually makes quite a few different products. They make toothpastes, mouth rinses, and saliva substitutes. Not everyone likes them. You can find them at the grocery store. Try it, see if you like it. The saliva substitute, some people say feels slimy, but if it works for you, great. Toothpaste can help stimulate saliva. There's also things that you can get from your dentist, such as there's different types of toothpaste that have fluoride in it that can help prevent those cavities that are starting to form because of the dry mouth. So those toothpastes are good for other things as well, but it can help you when you have dry mouth not get those cavities starting. There's also something called MI paste that I like to use for my patients with dry mouth, because it can help stimulate saliva. It can help you
Stimulate those glands.
Yes. There's also another prescription that you can get that is like a lollipop that you take 1 or 2 licks and it will help stimulate your saliva. You put it away for later use. Those are all things that you can talk to your dentist about and see if that would work for you.
Interesting. And you had brought up the fact about cavities because of the lack of saliva and because it can't get rid of the food particles around your teeth. And I was reading on here that, you'd think children would have the most cavities as they're growing up, but actually there's some issues with seniors' roots starting to show because their gums are receding, and that's where the cavities come in seniors more than like on top of the teeth like little kids have. Like
that is often true. If you're a senior and you haven't had a cavity in the top of your tooth, it's not that likely you're going to get one when you're older if you've made it that long. But as you age, the gum tissue sometimes does start to recede, and you want to keep it as clean as possible. But oftentimes, if plaque and stuff sits down there by the gum line, it can create a lot of cavities around the root surface of the tooth.
And receding gums, that's a whole issue in itself. But because your gums recede, not because of disease, but like mine, because I'm a very aggressive brusher, those can cause all kinds of issues in seniors. And one of them is sensitivity.
Definitely.
Now, what can you do about that?
Well, I always like to recommend Sensodyne toothpaste. That can help. If you do have a lot of root surface exposure, the Sensodyne can help it feel a little bit better.
What's in that makes it not hurt?
They take out some of the sensitivity agents like sodium lauryl sulfate, which is the foaming agent that's in toothpaste. So they just kind of make it a little more gentle. There's other things in there that can help with sensitivity. I'm not exactly sure the composition, but...
Okay, so if you used a toothpaste for sensitive teeth, that would probably help. And I know that is one of the issues, too, if your teeth hurt, that you're not going to eat. because it
Yes,
hurts
definitely.
to eat.
Definitely. And MI paste that I had mentioned before that can help stimulate saliva, that also has stuff in it that helps remineralize the teeth. It also has stuff that can help with sensitivity. Personally, I use it if I'm going to whiten ever. I like to use that MI paste beforehand, and it makes my teeth not sensitive. Otherwise, if I put any sort of whitening gel on it, my teeth are going to hurt for a couple days.
And that's an issue too, that I saw on here is changing color of the teeth of a senior. And there's a couple of different reasons. Why don't you talk about what causes teeth to darken as you get older? I mean, some of them I know is because of what you've eaten.
Definitely, I mean, coffee, tea, all that sort of stuff can stain the teeth. Also, your nerve starts to recede most of the time. And as that happens, the decreased blood supply, the tooth becomes a little bit more brittle. We get fracture lines, all sorts of things start to develop, and the tooth just isn't quite as nourished as it used to be. It doesn't have that blood supply all the way up into the crown of the tooth. And that can kind of make it less bright and white.
Well, and you mentioned something about blood supply, and I remember seeing in a couple different things here that diabetes can affect someone's dental health.
It definitely
and
can.
that affects the blood flow. So is that what the connection is between diabetes and changes in your teeth and stuff as you get older?
Well, one thing about diabetes, I mean, it definitely slows the healing process. So we see a lot of diabetics with gum disease and slow healing as far as any sort of procedure goes and all that.
But that's really interesting, though, because we have talked in past shows about diabetes and how it affects the blood flow in the body. And one of the things we talked about was the little bitty blood vessels in your eyes and how it can cause them to burst, and the circulation in your legs. So I'm thinking it would probably be the same type thing. You never really think about blood circulating to your teeth in your mouth, but obviously it does.
It does to the ones that haven't had root canals.
Very interesting, very interesting. Now, and when your teeth darken as you get older, which I have that issue also, when you do put something on to try to whiten them, it hurts.
Mm-hmm.
And so you have that same issue too.
Yeah, I have that same issue, and I do use MI paste before I whiten, and I don't have sensitivity if I do. It helps, and I've used it on a lot of patients just who have sensitive teeth. Some say it works and some say it doesn't, so it really just kind of depends, but why not try it? It can't hurt.
What's in the whitening products that makes it hurt? Is there... I was thinking maybe it was the hydrogen peroxide or something.
There's peroxides and that sort of stuff in it. I don't know exactly what causes it to hurt. It only hurts on certain people. Some people don't have a problem. You can whiten their teeth for hours.
But at least there's an option, because I've avoided doing that because it hurts. Mm-hmm. But if there's something I can do before,
I would use the MI paste before it and do it for less time with a lower percentage of bleach and go slowly. There's no rush. Don't do the high percentage for 2 hours. You won't be happy.
And there's something else I saw on here. It talks about the sense of taste that goes away as you get older.
It does.
That's terrible. I love to taste food.
Yes, that is unfortunate. Part of that is because of the lack of saliva, and also just not having all of those taste buds that are sensitive to the taste. I mean, you don't have the saliva to help dissolve the food, and so it just doesn't taste as good.
That saliva issue is touching everything that we're talking about. I mean, that's a major issue.
It is.
When you get those pieces of paper with your prescriptions, it's probably a good thing to look to see what the adverse effects are, because if that's one of them, you need to be aware of that.
Yes. In fact, I mean, most blood pressure medications, most of them, the side effect is dry mouth, and it's in a lot of other things. Yeah, but I mean, it's better to be healthy and have a dry mouth than it is to not take the medication. But do the things that you can to help at least prevent the cavities and make yourself more comfortable.
Very interesting, very interesting. And gum disease. Okay, we've kind of gone around this a little bit. Is that something you see more often in seniors?
You know, we see it in a wide variety of age ranges. I mean, it happens in young people and older people. Sometimes, well, the cause of gum disease really is as plaque sits on the teeth, it then, if it's not removed, starts to kind of move its way down the root surface of the tooth, turns into calculus, which is that hard material that you can't get off with a toothbrush anymore. And it works its way down the root surface. The gums move away from it. The bone moves away from it. So you have bone recession, gum recession, and it can be very damaging. You can end up losing your teeth. And I think one of the reasons it can happen in older people is you lose some dexterity as far as it goes with brushing your teeth. I often recommend getting a electric toothbrush, because if you lose some dexterity, at least that can help. All you have to do is place it in the right place and it can do the work for you. There are some cheaper electric toothbrushes that you can get. I think there's a cheaper Oral-B one. I think it's less than $20. I mean, obviously there's nice expensive ones that you can buy, but there's less expensive ones as well.
Well, I want to keep on talking about that because that's an issue. I remember watching my mother brush her teeth. So I want to keep talking about that. But we need to take a break. So we will be right back.
It's like, I don't know the answer to that.
That's okay.
Yeah, so some of those things, maybe just cut them out. It's like, I have no idea.
That's all right. No, we're good.
And I can't think of what that was about.
Diabetes.
Yeah, I don't really know what does that. And I don't really know what darkens people's teeth. I just say, they just get darker as we age. I'm not sure what exactly it is that does that. I mean,
Changes in dentin.
I don't know what changes would happen in dentin. I mean, I would think as far as I could think, we're not told. I was never told what it is, but I would think that if the nerve recedes, then it starts to. But it's like, oh, I don't know the answer.
That's fine. So let's keep talking about gum disease and about brushing, and that kind of will go into what you were saying, people's dexterity.
Yeah.
And we can talk about that for a little bit. And the whole thing around gum disease, because I think that's a big issue.
Yeah.
Especially if now the food stays on your mouth because of the saliva, and, So
end up with even more cavities because of it. Yeah.
So let's keep on that subject.
Okay. Sounds good.
And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Dr. LaRose here, and she's a dentist here in Coeur d'Alene. And we've been talking about issues pertaining to seniors and their oral care, different things that either happen exclusively to seniors or that happen to the general population and are exaggerated when you get old. And we had started talking about gum disease, and I find it very interesting what you're talking about, that it kind of moves down the tooth, like with gravity, the tooth surface, so to speak.
Yep.
And it causes the gums to move away and the bone to move away. Now, would that cause your teeth to get loose because the bone's not there anymore?
Definitely, it can definitely do that. The more bone and gum that you lose, the tooth will become looser and looser, and you can never get bone back. Once it starts to recede away, you can't make it come back. What you can do, depending on how much gums and bone has been lost, is deep cleanings, which, if is recommended, it can really help to reattach the gums to the tooth, so it can give your tooth more support.
And what was that the technical term you used of the hard?
Calculus. Yeah,
okay.
Plaque eventually turns into calculus if it's not removed and becomes hard, and you can't get it off with the toothbrush anymore, and it's down in areas underneath your gums where you can't get to anymore, which is why when you go to the dentist and they probe your teeth and they start reading off numbers 1, 2, 3, 1, 2s, and 3s are great. Once we get into 4, 5, 6, that's the distance that we're getting underneath your gums where it's not attached to your tooth anymore.
So what they're doing when they're poking you, because I can relate to that. I was just there. They're actually measuring how far down from where
your gums are attached. From where your gums, where you can see the top of your gums, then we measure from there all the way down to where your gum attaches to your tooth.
Okay.
So if it's a 5 or a 6, we're having 5 and 6 millimeters of just loose gum tissue around that tooth that's not helping support the tooth in any way. Which means, I mean, if you're around 5 and 6 millimeters, you've definitely lost some bone as well.
So that means the calculus is going down your root.
It has, yes, which is why we'll recommend deep cleaning. So what we do with that is the hygienist gets you numb because it's not the most comfortable and goes in and just cleans that root surface as good as they can. They get the calculus off so that your gums are better able to reattach to the tooth surface again. And oftentimes we're able to get good results. Getting a 4 millimeter pocket back to a 2 or a 5 millimeter pocket maybe back to a 4 or a 3. You're never able to, I mean, we're not going to get an 8 millimeter pocket back to a 1 or 2, but we can at least make it better and get closer and have better strength on those teeth. Like oftentimes people will come in with a lot of calculus buildup on their lower front teeth, and sometimes I can see that they don't have a lot of bone and they have a lot of calculus and their teeth feel pretty solid to them, and we go in and we clean them and take all that calculus off, and now all of a sudden their teeth feel loose and they think we did something wrong. But really it was that calculus that was solid in there holding those teeth, making them feel more solid. And
that
once we actually
between the tooth and the gum, and now there's nothing in that space, so that's
yes,
why
and it's
loose.
kind of gluing the teeth together. It kind of sticks between all of them so they feel solid because they're splinted together with calculus. Once we get all that off, they might feel a little looser, but over time those gums will be able to heal up around the teeth better and hold them more solid.
And all of that stems back to what we were talking about, the lack of saliva, because it can't get the stuff away from the teeth, and then the sensitivity, or even your physical conditions.
Yes, because with plaque and calculus accumulation, really brushing and flossing is the key. You need to get that plaque off of your teeth when it's soft so that it doesn't have the chance to develop into calculus and move its way down the tooth. So cleanings at your dental office are very important, at least every 6 months, if not more often. If you've had to have a deep cleaning, they usually have to be more often just to make sure that it doesn't come back and we can keep it nice and clean and maintain it where it is so you don't lose more bone.
And that's, again, one of the issues. I remember my mom watching, because we would travel with her, watching her brush her teeth. And like I said, I'm an aggressive brusher. I admit that. If I could have like extra soft toothbrushes, that would probably work. But she would brush her teeth very slowly, and I kept thinking, watching her, you're not doing anything. You're not getting anything off. But there might have been issues with her, with her ability to move. It might have been painful. It might have been painful to brush. You can't really tell that watching somebody.
Definitely. One thing I can say is the only amount of pressure that you actually need is the pressure that you can use with your thumb and your forefinger. So if you hold your toothbrush with your thumb and your forefinger, that's as hard as you need to be able to push on your teeth to get the plaque off. You don't need to use your whole fist and scrub.
Now, but I think I'm doing such a good job.
Now, you know, when dexterity and strength becomes an issue as we age, you might need to, you know, use your whole hand. But just keep in mind that the amount of pressure is not what is needed. It's the being thorough and covering every area and just making sure you get all the way up to the gums. We like to angle the toothbrush at about a 45-degree angle up towards the gum line and make sure that you nice and lightly scrub the teeth and the gums.
And if you have arthritis or issues like that, where you can't hold a regular toothbrush, I have seen different things at some of these stores that have assistive devices in them,
Mhm.
or you can put them on the end of toothbrushes to help you hold it if you'd rather not have an electric toothbrush.
Yeah, definitely.
Because toothbrushes, if you look at them, they're about the size of your little finger,
Right.
so far as diameter. And so for some people, especially as
It's
you get
hard to
older,
hold.
it's
Yeah.
hard to hold on to that.
Mhm.
So they've got things I've seen where you can stick the toothbrush in them. I've seen where they say take handles from a bicycle, and stick it in there or stuff like that. Something to make it easier to hold on
Anything to
to.
make it easier to hold on to, definitely. I would recommend, whatever makes it easier to do a good job.
So if you've got a parent who might have problems, arthritis in their hands, a lot of us do, maybe that might be something you might want to talk to them about. Is it hard for you to hold on to your toothbrush? Is it hard for you to brush your teeth? And if it is, help them to find something to make it easier, because this would alleviate a whole bunch of problems down the road.
Definitely. Definitely.
And as we get older, it's more important for us to be able to eat good, nutritious foods. And if you can't eat them because your mouth hurts,
Everything else is going to go
yeah,
down.
it's going to do the domino effect.
Yes.
Now, one of the things I saw on here was tooth loss, and that is a very traumatic thing at any age. And so, if someone does happen to have to lose their teeth, or whatever the reason, and have dentures, that's another issue pertaining to seniors that a lot of younger people don't have to deal with. Um, I remember, I remember dentures being something big and ugly, and they're not all like that anymore. Is that correct?
That's true. They are big, and if you look at them in your hand, it seems ridiculous, but we can make them look great, and we can make them look natural. If you like your teeth the way that they were, if you like one of them crooked or a little bit angled the way that it used to be, or a space in between your front teeth, we can do that. Bring in pictures, show us what you want it to look like, and we have great lab technicians that are really good at making them special for you and something that you're comfortable wearing. And it looks big, but it needs to be that way to provide that lip support for you and to have it look natural in your mouth when you're wearing it.
Well, that's interesting that you say that you can make it like that, because I remember way back when you could tell on a senior if they had dentures because their teeth were
perfect and white.
Yes.
Yeah.
And so now they'll make them so that it looks like what they
Yes,
did
and
before.
I mean we can make them perfectly straight, and if that's what you want, I mean straight, white, anything you want. But if you want them different, if you want smaller teeth, bigger teeth, rounder teeth, squarer teeth, spaces and angles and all that sort of thing. We can even add fillings and gold crowns to the dentures if you want them to really look like your teeth used to. We can do that.
Oh, interesting, because
Yeah.
before you could tell, you just knew someone had dentures, but if they do that now,
They
wouldn't
can
be
look
able to tell.
very natural. Yeah.
Wow, interesting. And I saw something here that said, talked about as you get older, I guess the way your inside of your mouth is structured might change.
Mhm.
And so dentures that fit you 10 years ago may not fit just the same way
Definitely.
now.
Yes, as you age, especially once teeth are lost, teeth help maintain bone. So once teeth are gone, bone will recede as you age. It is just what happens. So the longer you've been without teeth, the less bone that you will have. So as you age, you do need to replace your dentures after a certain period of time. Typically 10 years is kind of common. I know people who've gotten 20 and 30 years out of them, but are very happy when we make them new ones because they fit much, much better. They're not going to last. They can't last forever because your bone and your tissues just change. And by making a new one, we can make it fit you better.
So if I'm understanding what you just said, when you have teeth,
Mm-hmm.
your bone stays there.
Yes.
And when the tooth is gone,
Yes,
the bone
your
kinda goes
tooth
away?
creates a pressure in the bone, and that keeps it there and remodeling constantly. Once there's no teeth there, there's no pressure inside the bone, which doesn't keep it remodeling, so it slowly begins to recede. So your bottom jaw will become thinner and thinner, your top one will go farther up, and your chin will become closer to your nose, if that
Really?
kind of makes sense.
So, all right. So let's say you've got someone who has had their teeth pulled on the bottom
Mm-hmm.
and had dentures put in.
Mm-hmm.
Their facial structure is going to change.
It will without the dentures in. What we do with the dentures is we put them back where their nose is the correct distance from their chin, but the dentures will become, you could say, a little bit bigger as you age, sort of.
To keep pressure on the bone.
We want it, yeah, we want them to fit nice and snug up against the bone to keep them feeling good and feeling snug in your mouth so they don't feel like they're falling out. But we also want the correct space between the nose and the chin. So you kind of need to open up the jaw if they've lost a lot of bone, especially in the lower. We just need to keep that distance correct so you don't have jaw problems and look not as nice.
Oh, okay.
So-
Okay. So you, with the bone receding in the jaw, you make accommodations in the dentures for that.
Mm-hmm, we do.
Okay.
Yeah, with how much your jaw is open, if that kind of makes sense.
And when your jaw is uneven or not like it's supposed to be, that can cause all kinds of.
Mm-hmm. It can make it not feel good. It can make you not look as good. I mean, a person looks older if their chin and nose are very close together, like the incorrect distance. As it becomes closer and closer, your lips sink in and it looks like you're a lot older. You open them back up again into what they naturally should be, and all of a sudden it takes 10 and 20 years off their face. So,
Okay. So if, let me ask another question. So if you've got a person who's not keeping the dentures in their mouth,
mhm.
okay, what does that do to all of, will that affect?
It will still, the bone will recede away. Yeah.
Okay.
There's also, I mean, there's other options as far as dentures go. There are implants, and implants will function somewhat in the same way as teeth in that it will maintain the bone in that area. So if you do get implants to help support your dentures, they can, well, let me go back a little. Implants are like screws that we screw into the bone. So by doing that, it's like a tooth in that spot. So you'll get the sensation more like a tooth where you have the pressure in the bone rather than just a denture moving around on the tissues. So you can lock the denture into these implants and make it a lot more stable and also maintain your bone.
Oh, okay. So you don't necessarily have to have all the teeth pulled and then have an appliance put on. If you had some implants put in, that would help alleviate some of the bone deteriorating.
It would. And the sooner you have the implants placed, the less bone that's lost.
Okay. So it's really important if you've got, now, boy, so much information. So if you start noticing with your dentures that they're not fitting properly, they're not staying in.
Especially lower dentures. Almost nobody is happy with lower dentures. If you have to have lower full dentures, if you can have implants, I absolutely recommend it. It will change your life. Lower dentures, there's nothing to suction to. They just kind of flop around your mouth, and there's really nothing we can do to make them comfortable other than implants. People can function with them. I mean, people do all the time. But if it's an option, if you're thinking about it, do it.
Okay, so that's for the lower ones.
Yes.
For the top ones, when they start moving around, that means that your bones have
Oftentimes
changed?
your bone and your tissue remodels over time. So if it's been a while since you've had any sort of a a check or a reline done in the top, what we can do if the denture isn't old enough that you need to have a brand new one, we can actually reline the inside of it to make it fit your tissues better. So there are a couple different kinds of reliner materials. Some are gel-like and soft, and that's a temporary sort of thing where we can try it and see if you're comfortable with it and make it a lot better for a little while. And then if that worked for you, we remove that and actually take an impression with your denture and send it to the lab, and they're able to add more material into where that impression material was, so it fits it to your mouth, so that can feel a lot more snug again.
So your denture's not feeling right is totally normal.
Yes.
It's not something like, oh my gosh,
it is.
My dentures are broken or whatever.
It just
totally
happens
normal.
over time. Go in, get it checked out, see if there's something they can do. It doesn't always mean a new denture. Now, if it's, 25 and 30 years old, it probably does mean a new denture would be the best for you. But if it's just starting to feel loose, oftentimes we can fix it with a much less intense procedure.
And that would probably work better, because if they're loose or they hurt, you're not going to eat.
Correct. And if they hurt, if your dentures hurt, go in, because oftentimes it's a very simple, we see where that pressure spot is on your denture, and we fix it, and now all of a sudden you can eat with it again. So don't wait, just go in. That sore is not going to go away on its own.
And it's something that's normal.
It is. It
It's
happens
not
all the
something
time.
Okay, so remember that it's normal for that to happen. We do need to take another break, but we will be right back.
All right.
Now, one of the things it talks about on here is the kinds of things you look for when you do an examination on a senior. And before I bring it up, I want to ask you, because it says looking at different sores in the mouth, do you do all of that? Okay, so you can talk about.
Yeah, we're pretty much just looking for anything that's different, any sort of red, white, ulcered, anything like that area that hasn't healed.
Okay.
So if they notice sores in their mouth that aren't healing, 2 weeks is pretty normal.
Okay.
And then, so yeah, I do that every time for everybody though, not just older people, but just look for anything different. Make sure they don't have.
And talking about.
You're on a break, right?
Yes, sir.
Okay. We're getting ready to leave.
I'll lock up.
Yeah, just lock it, pull it behind you, and I'll come back and set the alarm later.
Okay.
All right.
Thanks.
We'll see you later.
Thank you. Yeah, it said something about checking like lymph nodes and stuff.
Yeah, I don't do that with everybody.
Okay.
If I see anything that's different, I will,
Okay.
but
Okay.
we don't.
And it talks about treating people with dementia. Is that something we can talk about?
Yeah, I don't mind treating people with dementia. We just have to be more patient.
Okay. And bringing up, like if you, I remember my mom would have to take antibiotics before going in for something. There's a special reason for that for seniors.
Yeah, we can talk about that. Well, not just seniors, but yeah.
Okay. All right.
Trying to think. Okay, I just won't get in depth. But yeah, no, that's good.
Okay. And we're back. This is Connie Clark with Home Helpers, and we're on the senior moment. And this afternoon, we've been talking with Dr. LaRose about oral care in seniors. And unfortunately, I'm relating to a lot of the stuff that we're talking about in here. But one of the things I know that comes up, especially in the senior industry, is folks with mild dementia or moderate dementia and having teeth problems and having to go to the dentist. That can be a traumatic event.
It
Talk about
definitely can be. what I like to do is, I mean, we do have patients with dementia and Alzheimer's, and what I like to do is just be patient. Just talk to them, be nice, explain things. They might need it explained multiple times, and I don't mind. We have a lot of nice assistants and hygienists that are really great with that as well. So just kind of walking them through it, just like anybody. I mean, explain what you're doing and try not to surprise them, I guess.
And it said something on here about using, and I'm, for lack of a better word, because I don't know the clinical terms, the laughing gas.
Yes,
Or
we
some-
do have nitrous, laughing gas, nitrous oxide, the same sort of thing. You just breathe it in through your nose with oxygen and nitrous oxide, and it just relaxes you. You can kind of use it in different dosages. So if you've had it before and you felt, oh no, I just felt too weird, I really didn't like it, tell your dentist that. They can kind of start at a lower percentage rate of nitrous oxide, and there might be just the perfect place that just feels nice and comfortable for you. All you want to do is just feel a little relaxed and nice and comfortable. You don't need to go to the point where you feel dizzy or anything like that.
And it would probably be a good idea if you've got a loved one who has some dementia issues, rather than putting off necessary oral care, to do it sooner than later.
It is better, because if we can fix it with a simple filling rather than going to an extraction, or now they need a root canal and a crown, it's going to be a lot easier on them to do something short like a filling. So, the better you can maintain it. Also with cleanings, if you can maintain their health, it's going to be a lot better for them in the long run, not to have to go through those big procedures.
And also, I remember back to my childhood or later years, my mother, when she would go to the dentist and she would have different procedures, they'd have her take antibiotics
Yes.
the night before. Now, what is the reason for that?
It's different now than it used to be. We don't have people take it the night before anymore. Now with the new guidelines, honestly, they come out with new guidelines every couple years or so, so we're always having to refresh. But now we don't pre-medicate for a lot of things, but we do pre-medicate for certain heart conditions, and often for artificial joints. If they're placed within a certain period of time, we will pre-medicate for those, and oftentimes it's just an hour before the procedure. We have you take that antibiotic, and then you come in, and that's all you have to do, just one dose before, an hour before.
And she did have those things.
Mm-hmm.
So, in taking the antibiotic, is it just a...
It's a precautionary,
preventative
yeah, it's preventative against any sort of bacterial invasion into the blood system. So it's just more likely that you could get bacteria into, say, those artificial joints, or into, say, an artificial heart valve and that sort of thing. So ask your dentist if it's something that you need. If you needed it 10 years ago, it doesn't necessarily mean you need it anymore. So things like heart murmur is not necessary to pre-medicate for anymore. But artificial heart valves and artificial joints, we still do like to pre-medicate for those.
And the reason for that is, say, for example, if you were going in to do a filling or something like that, where you would have...
Anything that's going to be invasive into the tissues is something that we would
where
pre-medicate for.
blood
If
would
it's just an
come out.
exam,
Okay.
yeah.
Well, that makes sense.
Yeah, so if it's just an exam, feel free to go in, talk to them about it, and let your dentist know, but you're safe to do that. And then anything after that, they'll let you know when you need to take that antibiotic.
So that's one of the important things, to letting your dentist know what your health conditions
Yes, that's why it's not just important to tell them the teeth problems you have, but let them know everything so that we can best plan for you.
are. And I see it says to make sure that when you go to the dentist, just like when you go to the doctor, bring a list of all the medications and
Yes.
dosages, and even over-the-counter things.
Yes, it's helpful for us to know everything, just in case. I mean, if there's something in there that you might not know about, and we do, that might help you, it's best to just have everything on hand so we know.
And when you do an examination, one of the things that we were talking about on the break was you look for sores and things inside the mouth?
We always do an oral cancer screening on everybody, no matter the age. Just kind of take a look in their mouth, on the tissues, anywhere, and just make sure that there are no sores or different red areas, white areas, areas that shouldn't be there. If there is something like that, oftentimes we'll just watch it for a couple weeks, and if it's something like, say, you bit your tongue or you bit your cheek, it will usually heal in about 2 weeks or so. So if you do notice a sore that hasn't healed or gone away, let your healthcare professional know.
Because again, going back and talking about people with diabetes, that's an issue. Is it takes longer?
It does take longer to heal, but we can kind of keep an eye on it, take pictures of it. We have intraoral cameras now where we can take a picture of it, measure it, make sure we know what it looks like, and then keep an eye on it and make sure it goes away rather than getting worse or staying for a long time. Then we need to look more into it and make sure that's nothing bad.
Very interesting. Is there anything else that you might want to share with us? Because in this conversation, I really wasn't expecting it to go everything to kind of link back to the amount of saliva and the acidity of the saliva in your mouth. But it kind of sounds like everything goes back to that.
It really does. I mean, having that saliva, it can really prevent a lot of problems. So, yeah, it is a disadvantage when you don't have it, but let your dentist know so that they can do what they can to help make it better, such as, the fluoride toothpaste we were talking about and other things to make you more comfortable and less likely to develop those cavities.
Well, and going back in the beginning, we were talking about how the acidity changes and every time you eat. What if you're chewing gum or you have a mint in your
Yes, that's
mouth?
something good. I'm glad you brought that up.
I just happened to think of that.
Chewing gum, as long as it's sugar-free, actually helps stimulate saliva and will bring your pH back to normal faster. So if you do eat something and then chew a piece of gum that is sugar-free, definitely, 20 minutes it takes to bring your pH back to normal rather than an hour. So that was something I did want to mention before. I do recommend things with xylitol in them. Certain Tridents have xylitol. Also some, I think, Mentos gums have xylitol. Look on the back of the pack and see if it says that. That's actually, it is a type of sugar substitute that is healthy for your teeth. It can help prevent cavities and all that. So chew a piece of gum after you eat, and that can help. Although if you do have jaw problems, that can kind of aggravate your jaw. So if that's the case, it might be better to not. They do have xylitol mints that you can get as well that you could have after eating, and that can help too.
I know when I had a lot of my crown work done many years ago, they said I couldn't chew gum because it would stick. And I have not since. Do they still have that issue with gum, or have they made it so it doesn't stick anymore?
It's not really the gum so much as our cement that we use on crowns now is so strong. I mean, it's going to take a lot more than gum to get that thing off.
Good, I can chew gum again. I haven't in probably 25 years, just because.
Well, go get a pack with xylitol in it.
And the mints that have it.
There are mints, yes, that have it. And xylitol is XYLITOL.
Okay. So that can actually help the saliva come back to where it's supposed to be.
It does. It helps it come back faster. So, because it stimulates saliva.
Okay. Very interesting. Very
Yep.
interesting. Any other tips for us?
Oh, not that I can think of, but
I think I really like the idea, though, of talking about the issue of saliva. I mean, that's not that glamorous a subject, but it really makes a lot of sense, because that seems to be the root, no pun, of all kinds of dental problems, is the lack of, or the pH.
it really does create a lot of problems. But, I mean, if you have any other questions, feel free to come ask me whenever you want.
I'm going to give them
Yes.
your information, if that's okay.
Great.
Dr. LaRose is on Lincoln,
On Lincoln Way, 1420 Lincoln Way.
and it's Kootenai Family Dental, and her number is 664-8283. And you can call and ask all kinds of questions and tell people that you heard us here on KYMS. But there's a couple of
Absolutely.
other things I want to talk about that are coming up that are really important. And one of them is this coming Tuesday over at the First Presbyterian Church. Idaho Army One Source and our local NAMI office, which is the National Alliance of Mental Illness, and the Idaho Catholic Charities, and Living Well Counseling and Consulting, and Transition Assistant Advisors. They are sponsoring a program. It's called PTSD 101, Faith, Community, Clergy, and Behavior Health Allies Supporting Our Troops. And it's going to be a couple speakers talking about PTSD in our community and how our faith-based ministries can help those military folks that are suffering with it, and kind of to understand what to look for and what some of the signs of PTSD. So it's really important. Again, that's going to be Tuesday, and it's from 8 to noon at the First Presbyterian Church downtown at 521 East Lakeside. So if you want some information on that, you can call me, and my number is 769-9560, or you can call Sheila Schumacher with Army One Source, and she is 660-5607. Also coming up in November, November is the National Diabetes Awareness Month, and on November 17th, Saturday in the morning from 8 to 1 over at the Panhandle Health District on Atlas, they're going to have Diabetes in You 2012. And they're going to have all kinds of information over there. They're going to have speakers. You can have medical reviews done, blood pressure checks, foot checks, pre-diabetic testing, A1C testing, glucose meters, door prizes. There's going to be vendor booths, educational presentations, and cooking demonstration. Yay! So you may want to head over there again on November 17th. It's a Saturday from 8 to 1 over at the Panhandle Health District. And Dr. LaRose, thank you for being with me this afternoon.
Well, thank you for having me.
And again, the saliva is the important piece. Okay. And you all have a wonderful rest of your afternoon. This has been the Senior Moment.